Hello everyone, welcome to Nurse Bestie Explains. Today we start with the topic of techniques of nursing management. Management techniques are systematic procedures. Okay, these management techniques are systematic procedures of investigating, planning, controlling, and supervising, which can be applied to the management problems. These techniques are applied to the problems. If the management faces any problem, how to solve that problem, which includes a systematic procedure of first investigating into the problem, planning, controlling and supervising. Okay, this is applied for solving the problems. There are 8 techniques of nursing management. First one is detection. To find out or discover something, what is happening or what is wrong. If any mistake happens in an organization, to find out what is wrong, what is actually happening, the techniques which include detection are input output analysis. Okay, so to identify the problem, first we have to detect input, what actually input, what come as an output. This analysis, in detail analysis. For example, any mistake or if a nurse has administered a drug mistakenly to a patient, something wrong happened, that whole situation has to be analyzed. Okay, input, from where the nurse has picked the drug, from the cupboard, which cupboard, is the cupboard label, like in some hospitals wards, there will be a cupboard where all expiry drugs will be kept to throw. Once the stock clearance is done, that time they will throw. Until that time, if that is not properly labeled, some nurses may come and pick up injections from that cupboard if the proper labeling is not there. Okay, like that, input, all that you have to inquire, input and output. Maybe poor labeling, the nurse was not aware that that cupboard is for outdated drugs. Like that, what is the output? Maybe for that, because of that, the nurse has given wrong drug, okay, or expired drug to the patient. That's why damage happened to the patient. Like that, complete input output analysis has to be done. Attitude survey. Okay, attitude survey means it is a research tool which is used to measure the opinion, feelings, beliefs and behavior of a specific group. Okay, if a nurse has done that mistake, wrong drug administration, you can give that attitude scale, a research tool, a tool which has some 10 questions or 20 questions to assess the attitude of that person, okay, or a group of people. Okay, that is attitude survey can be done. And production of the study. Okay, so production of study means it involves planning, organizing, controlling. What is the input and what labor. Okay, to do that work, how many people worked for that labor, raw material, what material they have used, what service they have provided, all that they have to check. Next one is evaluation. The second technique in nursing management is evaluation. To measure or estimate the value of an item. Okay, evaluation is to measure or estimate the value of an item. To check the value of an item, this can be done. This technique which includes in evaluations are job evaluation. Okay, whether a person joined 6 months back is performing her duties properly or not. By using a tool, a head nurse will evaluate how she is doing the job by using a tool. Job evaluation, work measurement, how much work they are doing, a list of all the works after entering into the ward, what nurse has done. Okay, she has done bed making, checked vitals of all the patients, administered drug at 10 o'clock according to the timing, and collected all the samples, followed doctor's notes. Like that, a list of activities will be there. Whether she has done all that or not, we have to check. Okay, that is work measurement and work estimation. In a general ward with 10 patients, how much work will be there? You can estimate by using some tools or observation. So how many nurses are required here to do the job perfectly in time? Like that, work estimation also can be done. Okay, that is one technique, evaluation, detection and evaluation. Third one is improvements. To improve performance. In order to improve performance of the employees, the techniques used here by the management are objectives and value analysis. Okay, if they want to make any improvements, they have to make changes in the objectives and value analysis. Value analysis means it is a systematic function based method for improving a product, okay, service or service. If it is a hospital, it is called as service, not product, okay. Service or process value by reducing the cost, okay. For example, if a hospital is running nicely, getting profits, but they are spending so much money, then only they are getting the profit. Both are almost equal. That means that hospital will not have any profits. That time value analysis will be done. Like for whatever material they are using, by using less material, how they can get more profits. Those technique, introduction of those techniques which helps in value analysis, okay. So that type of changes can be done in improvement. Next, optimization. To optimize performance, the technique used here are linear programming, operation research, etc. Okay, like linear programming means mathematical technique for finding the best outcome. Okay, that means if you take finances of the hospital, how much we are spending, how much we are paying for bills, electricity bill, other fuel, for the salaries, and how much profit we are getting, okay, with low cost. Like that, calculating all that mathematical details of the that particular hospital income, okay, that is done in linear programming and operations research, etc. These are comes under optimization technique. Next one is fifth one, specification. To specify a desired value of situation or action, the technique will be used here are layout, planning for offices and plans, etc. Okay. Specifically, you can check the desired value of situation or action, layout, planning, how the office can be planned. Okay. In less space, providing more services. That means you can build more rooms horizontally instead of going horizontally, vertically. Like 3-floor building, you can convert into 4 or 5 floors. So more wards you can introduce. Okay, with good plans and ventilation, like that you can improve the services. Specification, specifically working on something. Okay, layout, planning. Next one is control. The techniques used here are cost control, credit control, labor control, budget control, and inventory control. Okay, if we are getting less benefit and spending more, that time you can work on the control, controlling some techniques. Cost control. Okay, the same quality material you can bring it for less cost. Credit control. Okay, stop giving credit. Okay, only on payment provide the services. Labor control. If 10 nurses, same work they are doing, if 2 members are less, 8 nurses, if they are able to handle, run the ward with 8 nurses. Like that, labor control can be done. Budget control. And also inventory control. With less equipment, more output. Like that, inventory control can be done. Okay, managers will train, they follow these techniques to do this type of control. Next one is communication. To communicate information, the techniques used here are visual aids. If manager want to communicate, give some information, they use visual aids, okay, to the staff everywhere. Wherever there is a sink to wash hands, there one poster of hand washing technique will be pasted. Okay, that means all the steps of hand washing, how to clean nails, step by step hand washing. Okay, that is nothing but communicating the staff how to wash hands. Report writing, by writing report frequently, they are giving information to the management. Like this communication, by using scroll TVs in the OPDs. Okay, any information like dental hygiene, you can put a TV in the dental OPD. You can play the videos, how to brush your teeth, how frequently you have to clean, about the flossing procedure, okay, to avoid dental caries, how children has to be taken care. These videos you can play continuously. People waiting for the doctor checkup, they can see those videos and you can educate them. Like that, information can be communicated by using visual aids, report writing, and giving information to the management in writing or orally. Next one is demonstration. To demonstrate something, the techniques used here are programmed learning, job instruction. Okay, programmed learning. A class or a video is programmed. You can just play the video and learn. job instruction, the managers can give instruction how to do their jobs, management development and training. Sometimes once in every 6 months, all the staff members will be given training. Okay, any improvements, new technologies, new research advancements, the job training and development programs will be conducted. Like that, you can use this. Okay, so these are the techniques of nursing management. What are they? First one is detection, evaluation, improvements, optimization, specification, control, communication, and last one is demonstration. Okay, these are the 8 techniques of nursing management.